The medications that he was on was bisocodyl at 5 milligrams BID PRN, and that is a laxative, acetaminophen at 650 milligrams Q4 PRN for mild pain ranging from 1 to 3 on the scale, and it's an analgesic. The mechanism of action is that it's thought to act primarily in the central nervous system, increasing the pain threshold by inhibiting both isoforms of cyclooxygenase and enzymes involved in prostaglandin synthesis. He was also taking albumin at 250 milliliters PRN for systolic blood pressure lower than 90, and it's a hormone that they use to increase blood volume. Amiodarone at 0.5 milligrams per minute, which is an antiarrhythmic. The mechanism of action is that it prolongs the myocardial cell action potential, which is phase 3. It prolongs the duration and refractory period and acts as a non-competitive A and B adrenergic inhibitor. Dopamine at 2 micrograms per kilogram per minute, which is a hormone. The mechanism of action is that it produces positive chronotropic and inotropic effects on the myocardium, resulting in increased heart rate and cardiac contractility. And it does that by exerting an agonist action on beta adrenoceptors and indirectly by causing a release of norepinephrine from storage sites in sympathetic nerve endings. And in the brain, it acts as an agonist to the 5 dopamine receptor subtypes. He was also taking epinephrine at 0.1 micrograms per kilogram per minute, and it's a vasoconstrictor. The mode of action is that it acts on alpha and beta adrenergic receptors, and is the strongest alpha receptor activator. When it acts on the alpha adrenergic receptors, it minimizes the vasodilation and increases the vascular permeability that occurs during anaphylaxis, which can cause a loss of intravascular fluid volume as well as hypotension. It also relaxes the smooth muscle of the bronchi and iris and is a histamine antagonist. So it's useful in treating the manifestations of allergic reactions and associated conditions. It also produces an increase in blood sugar and increases glycogenolysis in the liver. When it acts on the beta adrenergic receptors, it leads to bronchial smooth muscle relaxation that helps to relieve bronchospasms, wheezing, and dyspnea that occur during anaphylaxis. He was also taking insulin, 3 units TID, and that's for his hypoglycemia. Metoclopramide, 5 milligrams Q6, which is a gut motility stimulator. The mode of action is that it inhibits gastric smooth muscle relaxation produced by dopamine. Therefore, it increases cholinergic response of the gastrointestinal smooth muscle. It accelerates intestinal transit and gastric emptying by preventing relaxation of gastric body, and it increases the phasic activity of the antrum. It also relaxes the upper small intestine, resulting in an improved coordination between the body and antrum of the stomach and the upper small intestine. It also decreases reflux into the esophagus by increasing the resting pressure of the lower esophageal sphincter and improves acid clearance from the esophagus by increasing amplitude of esophageal peristaltic contractions. It also raises the threshold of activity in the chemoreceptor trigger zone and decreases the input from afferent visceral nerves. He was also taking morphine at 2 milligrams Q2 minutes PRN, and this was given for pain. The exact mechanism of action is unknown, but there are specific central nervous system opiate receptors that have been identified and likely play a role in these effects. Morphine acts on the mu-opioid receptors, and it causes respiratory depression due to a reduction in the responsiveness of the brainstem respiratory centers to increase in carbon dioxide tension and to electrical stimulation. And it has been shown to bind to and inhibit GABA inhibitory interneurons, which normally inhibit the descending pain inhibition pathway. So without the inhibitory signals, pain modulation can proceed downstream. He was also taking ondansetron 4 mg Q6 PRN. It's a 5-HT3 antagonist, and it's given to prevent nausea. The mode of action is that it is a selective serotonin 5-HT3 receptor antagonist, and its antiemetic activity is brought about through the inhibition of the 5-HT3 receptors present both centrally and peripherally, which is in the GI tract. The inhibition of 5-HT3 receptors in turn inhibits the visceral afferent stimulation of the vomiting center, likely indirectly at the level of the area postrema, as well as through direct inhibition of serotonin activity within the area postrema and the chemoreceptor trigger zone. Propofol was given at 10 micrograms per kilogram per minute, and this is a sedative. The mode of action involves a positive modulation of the inhibitory function of the neurotransmitter GABA through GABA-A receptors. Precedex 0.2 micrograms per kilogram per hour, which is also a sedative, but it doesn't depress the respiratory drive as much as the other sedatives. The mechanism of action is that it is a specific and selective alpha-2 adrenoceptor agonist, and by binding to the presynaptic alpha-2 adrenoceptors it inhibits the release of norepinephrine, therefore terminates the propagation of pain signals. Activation of the postsynaptic alpha-2 adrenoceptors inhibits the sympathetic activity, which decreases blood pressure and heart rate. Pantoprazole 40 mg Q12, it's a proton pump inhibitor. For the mechanism of action, it suppresses the final step in gastric acid production by forming a covalent bond to two sides of the ATPase enzyme system at the secretory surface of the gastric parietal cell. The effect is dose-related and leads to inhibition of both basal and stimulated gastric acid secretion irrespective of the stimulus. Nafcillin 2 grams Q4, which is a penicillin antibiotic. The mode of action is that it exerts a bactericidal action against penicillin-susceptible microorganisms during the state of active multiplication in the bacterial cell wall synthesis. It inhibits the biosynthesis of the bacterial cell wall by forming covalent bonds with penicillin-binding proteins. They play a critical role in the final transpeptidation process. Binding to penicillin-binding proteins inhibits the transpeptidase and carboxypeptidase activities conferred by these proteins and prevents the formation of the crosslinks. And last, he was on allopurinol 200 mg daily, which is a uric acid reducer. For the mode of action, it inhibits the enzyme xanthine oxidase, blocking the conversion of the oxypurines hypoxanthine and xanthine to uric acid. Elevated concentrations of these will inhibit xanthine oxidase through negative feedback results in a decrease in the concentrations of uric acid in the serum and urine. So this drug facilitates the incorporation of hypoxanthine and xanthine into DNA and RNA, leading to a feedback inhibition of de novo purine synthesis and a decrease in serum uric acid concentrations as a result of an increase in nucleotide concentration.